Hi, my name is Rick Olderman. I'm a physical therapist and hand somatics practitioner, and I wanted to talk to you about neck pain and headaches. What's going on here? Many of you probably have had treatments where they've done painful suboccipital releases in the back of your skull here, trigger point releases, cervical traction, even manipulation of the neck to solve your neck pain and headaches, but you still have chronic neck pain and headaches. Why is that? Well, I believe that it's due to looking in the wrong place. So this is what I do in the clinic, and this is what you'll be focusing on in your program here. I believe, and my experience is, that the main stressor to the neck is actually from the shoulder. And that's because of these two significant attachments from the shoulder blade into the cervical spine and the base of the skull. And if no one has treated your shoulder before, I think you're in for a big surprise, and I think a happy surprise, about how you respond to this type of treatment. Let's focus on one of the muscles here. There's this one called the levator scapula, which starts here at the corner of the scapula and inserts into C1, 2, 3, and 4, sometimes 5 and even 6. Now, many of the people who I see who complain of neck pain and headaches, they are always complaining that they're feeling pain right here. This is always burning on them. Well, in most cases, this is the levator scapula that is burning, and it's because it's doing too much work. And you can see how small it is, so I describe it as kind of a pinky muscle. It's not made to do a lot of work, but it's there to do some work. But if we look over here to the other side, you'll see that this massive trapezius muscle right here inserts into the base of the skull all of the vertebrae all the way down the spine, and then inserts here at the shoulder blade. So it is the primary mover and shaker of that shoulder blade. I describe this one as a hand muscle. So the hand muscle, the trapezius, is supposed to do the majority of the work. If it isn't doing the work, then it's left up to that pinky. And you can imagine if you had to go to work only being able to use your pinky, it would become quite strained at the end of the day. And that's what's happening with the levator scapula. There are rules about how the shoulder blade should be resting and moving. And again, if no one has looked at this, you'll be able to see this and test this for yourself on the website. The scapula should be resting at T2 and roughly be resting about 3 inches from the spine. And the whole purpose of the shoulder blade is to help the arm move overhead. And there are rules about how this should be happening. You can see that the shoulder blade here is a broad, flat bone, so it's made for heavy lifting, kind of like one of the pelvic muscles, or I'm sorry, one of the pelvic bones. So when the arm is moving overhead, the shoulder blade should be rotating at about 60 degrees. And this outer part should be coming up to the cervical vertebrae, and then this little corner here should be coming out to about the midpoint of your thorax, kind of where the seam of your shirt is. If this isn't happening, then excessive stress is usually delivered via the levator scapula up into the cervical spine. Well, what about disc bulges and facet issues and so forth? Many of you probably have had MRIs and X-rays that show structural changes to the cervical spine and have been told that this is the reason why you're having neck pain. Well, I have to tell you, I see lots of these kinds of diagnoses of disc bulges, arthritis of the facet joints, degenerative disc disease, and we solve their pain. And it's because that is not the source of their pain. I believe that the source of the pain is the functional issues that are going on with the shoulder blade not working properly. That is delivering stress to the cervical spine, and in my opinion, probably creating or at least contributing to the formation of a lot of those structural things that are showing up on your MRIs and X-rays. So if we solve the functional stresses to the cervical spine and the head, then pain and headaches typically go away. And that's what this program is all about, is solving the functional stressors. Well, where do I go from here? Well, you can go to Fixneucom and visit the top tests and tips and get started on understanding and fixing your pain. You can also go to Fixneucom and join the interactive online clinic and finally solve all of these systemic issues that are creating your pain. Regardless, I want to thank you for watching this video, and I hope to see you at the Fixing You Interactive Online Clinic. Thanks.